All set? Welcome everybody to the July 8th Commission on Aging meeting. I'd like to call the meeting to order. And first agenda item is the approval of the minutes from June 10th. It's been called to my attention that there's been a correction to the transportation notes. It is not a committee, it's a commission. So we'll make that change. Are there any other changes or additions or corrections? If not, do I hear? Ruth, you're on mute. Can you?
You're not, Ruth. It's the city. Hold on.
How did you know she had a question?
I saw her.
Huh? Technical difficulties.
Did you just say that Jill's the best director ever?
That was the just.
Oh, there you are. Okay, we can hear you now.
Okay, Ruth, what was your point here?
Okay, under the report from the department, about 7 bullets down. But Jill, you had, the senior center will begin offering a congregate meal at the Fitchburg Hy-Vee on July 7th. There was an indication on the last sentence, there will not be a meal served at the senior center on these Wednesdays. But what Wednesdays are you talking about? Is it one, like the first Wednesday of each month or every Wednesday, or when are these being offered?
Sure, it's every Wednesday now through the end of the year.
Oh, it is?
Yeah, so thanks for clarifying.
Okay.
Is that the calendar year? Okay. Do I hear a motion for approval?
So moved.
Second.
All in favor?
Aye.
Opposed? Abstentions? Minutes are approved. There are no public appearance items for non-agenda items, so we'll move to the first agenda item of the 2022 budget. Jill?
All right, so we got budget papers a couple weeks ago and just starting to work on that. The biggest thing that we're going to put in is a new position, and this was discussed many years ago when they talked about Town of Madison coming on board and what would each department need. And I requested another social worker because Town of Madison has senior apartments, and that combination with just the increased aging population here in Fitchburg, and now we are very well aware of all the senior housing coming, it feels even more justified. So I did ask for a full-time case manager. The mayor does support this request. They did say that they would like for that social worker to start in July. We annexed the Town of Madison in October of 2022, but I am going to put it in for a July or a January 1st start anyway, just because I think that the difficulty and the complexity of the cases that we're seeing and the time that's being spent on these cases is just increasing. And I will have Amy and Sarah write up some of these cases that will give you an example of the time that's being spent. A good example is a client that we have known for quite some time who has absolutely no family, none whatsoever. This client is in their 80s and had a recent health condition, was hospitalized. Hospital called us and said, there's no POA, we need somebody right away. They have this surgery they have to have. And Amy worked through her vacation to try to support this client, and finally we came up with a solution, or she did, but very, very time consuming, not an easy process. But that's what we're seeing, is just more people that don't have the support system in place. And so, and I think, for justification, just for the community, like, well, why do older people get all this support and services, and I think that it's so cost savings, and we're going to try to work really hard to show what that cost saving is when someone is just by themselves and all of a sudden gets hospitalized and goes to a nursing home because there's no prevention or intervention. It's very expensive when they don't have money. We all pay for that down the road. So, you know, the nature of social work is prevention, hopefully. So we're going to ask for that. You know, obviously the salary is the biggest cost of that. And then along with that is space. We did have student interns work in the receptionist area. We have an extra computer. But what we are proposing, and I did run it by our interim city administrator as well as the recreation department, is there is a meeting room right next to the receptionist desk. It used to be initially, it was the computer lab when we renovated, and then we got rid of all the computers because computer labs just take up space. And during COVID, Amy started to office in there because it was good to keep her and Sarah socially distanced, and it was working out really well. And then as we looked towards that room and looked at how many programs are we really holding in there, could we take over that space and make it a social worker's office? And so we had, after some discussion, we thought that's a great idea, because if we get this social worker, that's 3 social workers. If we get another student intern, that is a space that they could do. So Ruth, I'll show this on the TV as well, but I had a company come in and give us a design, and that is what I'm passing around the design, but Amy would kind of stay in the back. Sarah would bring her whole desk setup in there. So all we would need was one more desk setup to put in there, and then maybe a long table where clients can come in. Because right now when clients come in, they oftentimes scoot around to the social workers, you know, cubicle. And so all of their private space, you know, there's no separation if they're doing a Med D plan or, you know, just trying to show them something or an application of any sorts. They're kind of right in their space. So we're looking to set up a little bit of a different space. And then the vacant social worker's office, we would move all of our durable medical equipment in that office, which would be amazing, because if you've ever seen our back room, it is just full of wheelchairs and walkers and commodes and bath benches. And, you know, someone said, do you guys really use all that? And we do. It's amazing. At least twice a week, somebody is coming to pick up durable medical equipment, which I think is awesome, because, you know, you don't want people to go buy that stuff for a short-term, you know, rehab situation. People call families coming into town, I need a wheelchair. So to be able to organize that in a room and sort of make it a resource room would be really, really amazing. And then it would free up storage in the back. You know, as you know, storage is always an issue, and we've got a lot of stuff now tucked away in places it shouldn't be. So anyway, that is the proposal. That will be the biggest request in our budget. Otherwise, it's really status quo again. You know, our operating expenses really are around $30,000, and they're relatively low. We're just heavy on staffing, like a lot of departments. So no big request except for that full-time position. Any questions?
Yeah, Jill, are you saying that all 3 social workers would be in that new office space?
Correct. Yeah, we would move them all in there.
Okay, and then did you add the cost of the cubicle, et cetera, for the new person?
We will be. I'll be getting a pricing. They just, in fact, I'll send you the design, but they just sent the design this week. And then there's also a computer setup. In fact, and then when I was walking over here for the meeting, I just passed Matt, our IT guy. So he's going down there to make sure that we have all of the network connections, the phone connections, and that sort of thing. Luckily, when we did the renovation, they put a ton of stuff in there, probably thanks to Fact TV, saying, you're going to need this stuff down the road. We've got a ton of outlets on the floor because it was a computer lab. We've got a lot of HDMI connections, and so I don't think that that's going to be cost. It's not going to be an extra expense, and nor did the IT think that. So that's kind of nice. So the bulk of it will be just a new desk set up for an additional social worker and maybe an additional 6-foot table that kind of matches. But otherwise, I think that's it.
I think it's a great resolution.
Yeah, I was a little nervous. At first I was like, we can't take up a meeting space, but after talking to the rec department, they don't use that space a ton, and it's really just going to require us to maybe move some stuff upstairs, and which means that you set up more tables and chairs, but we'll work it out. I think that this is better use of that space, and also too, again, the durable medical equipment closet. It's a mess, and there's just no way to organize it because there's nowhere to put anything. And then we try to, and we get a lot of stuff donated, and you'll come in the morning, and all of a sudden in the foyer there's 3 walkers and a pair of crutches, and and nobody told us it was coming, and so we try to dispose of the old stuff in a good recyclable way. There used to be a company that would take old durable medical equipment and send it to countries that need it. That company, that nonprofit, doesn't exist anymore, so we're looking for alternate ways to recycle old stuff and bring in new stuff. But people are very generous in donating new stuff that they bought, not realizing that we had a loan closet. So yeah.
Okay, thank you, Jill. Next up is Plan for Growth update.
All right, well, and Linda and Barb and Ruth can chime in at any time, but we met again our second time, and we did kind of a brainstorming session on sort of some key words that we would like to include in a mission statement. And so lots of discussion, lots of ideas, and some of the key phrases, I'll just point out a few that we had put up on the board, and Linda so nicely wrote down so we would remember what we talked about. Vitality, sense of purpose, lifelong learning, engage the community, innovate, open to reimagining aging. So some really fun words that have some fun energy that I think will send a little bit of a different message than we have in the past. So we'll be meeting again at the end of this month to kind of bring our templates, our thoughts, our examples of mission statements that we're going to all write based on these words that we came up with, and then go from there. So Linda, Barb, Ruth, have anything to add?
No, I think that pretty well sums it up.
Also, too, I did get an email from the city that possibly we will have to turn this committee into a formal ad hoc committee because there are 3 commission members, which means it's really close to a quorum. So it was advised that it become more of a formal group. And so that would just be a mayoral appointment, not a big process. So I'll let you know how that goes. But if you're official, then we really have to behave in a different way. Just kidding.
Sure, that'll help.
Yeah.
Okay, transportation needs.
All right. So I'm going to keep this topic on the forefront because it's just troublesome. For some reason, this month, we lost 3.5 hours of county contracted transportation services. I still haven't gotten the justification why. Our pickups used to be at 9:30. And all of a sudden, I got a new schedule that said they're starting at 10:15. So this is troublesome for a lot of different reasons. A lot of our people that use the bus came to functional fitness, which starts at 11. With a 9:30 pickup, we oftentimes could identify those that wanted to be on that first pickup route, and they would get here in time for exercise. That's no longer going to be an option, and I'm not sure why. The county, again, cut those hours. The other issue is that a 10:15 start pickup gets people here at about 11:30. Some of those people are on the bus nearly as long as they're here, and that's completely inappropriate and upsetting to me. So I've reached out to Dane County twice now to see why our hours got reduced and the justification. And the other thing is that they did it without even discussing it, and it was just kind of frustrating. So I'm waiting to hear back. But, we talked about transportation before. We talked about approaching the developers. I think, Ruth, you brought that up. So I did reach out to economic development, and my email then was forwarded to planning and zoning. And I did request that we look at the possibility of when developers approach the city about developing and get the approval, that there is some money set aside for transportation if that's something they don't provide for their seniors. like the park dedication money. And so at this point, it has to go to the city attorney. Nobody quite knew. Could they just make a new ordinance or a new, law that says, or a policy that states that? So at least it's up for discussion. I wasn't shut down. So I will follow up with the attorney once that discussion happens. The other thing I'm going to do is I am going to attend a county transportation meeting. So Don Ashbaugh, who used to sit on our commission last year, he does serve on the County Transportation Commission. So I'm going to go to them and talk to them about transportation and a way to look at that differently than just saying, we're only transporting people to get them here to eat. And that's the purpose. That's the purpose of the Older Americans Act money, is to get people here to eat a meal. But I have consistently said, it's not about the food, it's about what happens before and after. And to get people here for a meal is to get them to participate and exercise and enjoy other programs. So I don't think it's gonna help any, but at least, at least I'm gonna try and say, it's not just about the pork roast. It's not, they're not coming just for food. I understand that there's a nutritional value for a lot of people that don't cook and provide healthy meals for themselves. But I guarantee people are people that came for lunch and exercise. If they can't get here for exercise, I bet they will stop coming. I think we're going to see a decline. So anyway, I'm going to approach it that way. And then the third thing that I want to look at is maybe subcontracting with other facilities that have buses with wheelchair lifts. There's a couple in town that have senior housings that have buses that they don't use very often. I think there's a lot, this is why we don't have our own bus. It's hard to find drivers, it's expensive, on and on and on. But why don't we continue to look outside the box and look at something that is already in place, and maybe we can look at a way that we can partner with another business and use their transportation, very much like we do the Boys and Girls Club for Hispanic Bingo, which I hope to do again this fall. So lots of different ideas. I did also reach out to the city's Transit and Transportation Commission staff liaison, Andrew, to see if I could get on their agenda and just talk about the concerns that we have, the needs, the ideas. I think, just building that awareness obviously has to happen first. And we've talked about it sort of here locally with our commission and the Friends, but we really need a stronger voice at the city level. Bill Horns, who is a member of the Fitchburg Senior Center Friends, was recently appointed as the chair of that Transportation Commission, and so he and I are going to meet as well and talk about how we can present this information to that commission, and then see where it goes from there.
Okay. Marcia, are you ready for the Senior Center Friends?
Yes, thank you. The first thing I want to report is that our special needs for the month of June was about $490. We are making plans for September, which has always been National Senior Center Month, and we've done a variety of things in years past. We're talking to 4 restaurants that will basically share in the profits during their open hours on a Wednesday that month. So Benvenuto's is on the list. And me and Julio's, they've done it before. This year we're talking to Funk's Pub as well, and the Hop House. The travel committee is planning a travel show on August 25th, and they'll introduce some of the new tours that are planned for 2022. So the Western Canada trip that was rescheduled from July hopes to go in September, assuming Canada opens up their borders to tourism. There's also a trip that's going to New England in October of 2021. Originally, the first trip went in 2019, and I was on that one. And I guess we bragged about it so much that it was scheduled again for 2020, which obviously got canceled. So there's a good group already signed up for that trip. Then Costa Rica has been announced for a while. That's a winter trip, February of 2022. 3 new tours will be promoted for 2022. One is a motor coach from Chicago to, first of all, Holland, Michigan for the Tulip Festival there, and then on to Mackinac Island for 2 nights at the Grand Hotel. And then coming back south, they will stop in Detroit for a couple of sites and a night or two. In July, they plan to offer a Colorado Historic Trains. September of 2022 will be National Parks of the Southwest, which is always a popular place to go. So new flyers will be available soon. They're located right near where Susie sits in the office for all of these tours. There's also some planning going on for a day trip that would be in Wisconsin in December of 2021. We will need to rent a bus and then sell tickets, but it's for a kind of a musical show that's up in the Fox Valley somewhere. The Friends are having a great deal of difficulty finding new board members. With the pandemic, of course, and the center being closed, we haven't had an opportunity to meet new people. So we're hoping that some people will come out of the woodwork, because we need to get our board up to capacity by October. So if you know of anyone that might make a good director on the board, please let them know, and then let me know or another board member, pass the names on. Thank you.
Okay, any questions for Marcia? My friends? Jill, Director's Report.
Okay, and Marcia, I'll let you know that I've seen people coming and picking up the travel brochures recently.
Oh, great.
Yeah, a lot of people, where are those brochures? So
Yeah,
that's nice.
good.
People are ready to get out and get moving, I think. All right, so let's see. Just overview of senior center activities. Things are, just moving right along as normal. I think Tuesday we had 30 uke players. We had 4 or 5 tables of euchre players. Yesterday I bet there was 30 plus Fitchburg singers in there. So happy to be back. So things feel really normal. August, we even have more programs coming back, just a lot of drop-ins that we'll start promoting more, like, Mahjong and Scrabble and Bunko and Bingo will be back this month too. So it really does feel fairly normal. And again, we'll be offering some presentations hybrid with the in-person and the Zoom. Still, our aerobics class is about half are Zooming and half are coming in person. So I love that people are taking advantage of that. We did our Juneteenth celebration, and we served 85 lunches, so that was amazing. And I think it was just, I feel proud that we were able to celebrate that historical event, and I think even educate a few people about that. So that was great, and hats off to Susie, who did a lot of the planning for that. Let's see, Hy-Vee started yesterday. So as Ruth mentioned, we talked about it's going to be every single Wednesday. And just a reminder, this is a pilot program that Dane County approached us about, and it's just a way of extending a larger net to people that might have nutritional needs but wouldn't come and eat at the senior center, and just offering a different variety rather than eating at the senior center. So we had 27 people show up, which I thought was pretty good for a first time around. Then I was feeling really good so the other Hy-Vees on Whitney Way, And then on the east side, they also are doing the exact same thing with the exact same menu, the exact same hours. So if you don't want to eat in Fitchburg Hy-Vee, you can go over off of Midvale. I think that the Midvale, the east side location had like 100 participants and the other one had 48. So my competitive nature, I will be rallying a lot of people to show up next Wednesday. But anyway, Mandy was there all day. We had a couple volunteers go over as well. There's still a lot of kinks to work out, but I think overall people were pretty happy. The downside was we had several people that were coming to our site on Wednesdays for exercise and lunch, and several of these people said, I don't want to go to lunch, I want to come to exercise. So then we were scrambling to get a couple volunteers to get people over here for exercise, because that's why they came. So we'll work it out. I'm still trying to keep an open mind about that. I think, if anything, it's a great marketing tool. Mandy said there were several people. They were kind of poaching people from the grocery store too, which is awesome. You have to be careful because you should be over 60, so you don't want to approach someone if they're not over 60 and just assume they are. But to share the menu, and it's a really nice meal selection, I'll say. There's 4 different selections for breakfast and then 4 for lunch. And so, you can eat anything from 10 to 1. So anyway, I think it will grow and it'll be a good thing. We met with 2 new medical students. These are second-year medical students, and so we are going to do a series of, we talked to them a little bit, but we moved towards a brain fitness series where we're going to do some, and they'll be in person, so that's kind of nice. We'll offer it virtual, but the students themselves will be here. And so in August, we'll offer 2 programs about brain fitness, and we're still honing in on what it's going to be, but we'll do some memory screenings and just talk about maybe nutrition and brain health and just anything related to that. So they'll do all the research and they'll pick the 3 topics that they want to offer come August. Yeah.
Great. Is that, do participants come here, or are they on Zoom, or both?
Both. Yep, so you can be in person with them or you can do it for Zoom. So looking forward to working with them. It's always fun to work with students. And to me, too, it's also a great educational opportunity to share with them what a senior center really is versus what they think it is, because they're always surprised. Let's see. In your newsletter, there is an advocacy training. I know I've sent you guys some stuff about some legislation coming down the pike, but Dane County puts this on every year. It's a great training. It's called Senior Advocacy, and you meet with federal, state, county elected officials. You learn a little bit about the budget process that we have to go through to get our funding, and they have different kind of speakers. Generally, the county exec is there, maybe a senator, Wisconsin rep, or they'll send a staffer. But anyway, this year it's on Zoom or it's virtual. So again, if you have any interest in this process, it's a really educational training to go through, and it's free. So the dates are Tuesday, July 27th, and then August 3rd and August 10th. You can have this. Yeah. So those flyers are downstairs or in your newsletter. And then another thing in our newsletter is an online survey put out by Dane County. It's called Make Your Voice Count. And this is about their 22 to 24 aging plan. And it's easy to fill out. And it really, you send your thoughts about what Dane County should fund. And so, our struggles with transportation, this would be a great opportunity to say, we need more transportation for older adults. Transportation is so tied to age-friendly communities, which is something that I'll be pushing, that is a vital component of an age-friendly community, and not just for older adults, but for anybody. To be able to move around a city is really important. So I encourage you to grab that newsletter, find that link. I don't know, we might have that link on our website too, where you can just click and fill out that survey. If not, I'll make sure we get it on there. So yeah, make your voice count.
Got a point there. Legislators, they always say, oh, we listen to our constituency, but I think that we as citizens, need to really advocate for these items, do the surveys, call people, send emails, because, you know, it's one thing to say, well, the commission is presenting that, but when it gets down to the nitty gritty, when actual citizens are making that contact, it really has a big impact.
Nope, you're right. I mean, from all the training that, you know, I have been through, they say if a senator or legislator hears from about 7 people, they start to listen. You know, it's about 7 to 10. And so that's not very much, you know. So, you know, it can't hurt, that's for sure. Next month, Dane County budget priorities. So that's kind of connected to that training. I'm looking for my budget priorities for Dane County. So that's what happens. That's a process that I go through to do my own advocacy for focal points. So we get funding for nutrition, case management, and then medical assistance case management. But the county, the focal points get together and we decide what are priorities that we want to go to the Dane County Board and ask for. What are our requests? And case management is always up there. The county spends about, over 100,000 of like general funds. It's non-mandated, split between 12 focal points to help fund case management at these local levels. MA case management, we get we are able to bill up to 14,000 for MA case management. So that's not guaranteed money, but we always bill to the amount that they allow. And there has been times where we can bill for more. And then nutrition is always up there too. The county does supplement the Older Americans Act funding to help the nutrition program because it's really funded by Older Americans Act and donations, and that's really it. So that's always a request. There's going to be a request to continue to support the new mental health program that was implemented this year, where the county specifically has a geriatric nurse and a clinical social worker to deal with people with mental health issues. The issues that we're finding is that it's not for people on medical assistance. And so there's this gap, I think, of services that need to be provided for people on medical assistance. That they feel like their service is already available to people on medical assistance. But the problem is a lot of the folks that have mental health, they don't self-identify as having mental health, so they don't seek out services. So to be able to use this nurse and clinical social worker to meet with somebody in their own home and just, very gently and friendly sort of talk to them about what their issues are would be really helpful. Not that MA and mental health go hand in hand, but we do see a lot of clients struggling that could use mental health services that are on medical assistance. But on the other hand, we have a great service available. So that will be a funding request for Dane County. And then lastly, they added a funding request in the amount of about $50,000. Here it is, for an Asian cultural diversity coordinator. So right now, we work very closely with the Hispanic cultural diversity coordinator and the African American, and they feel that there's a segment of the population that still needs more outreach. So there is a request at $54,000 for this cultural diversity person to hire somebody that would do more outreach and serve more Asian older adults. So what happens next, and I just found my page, our case management request for 2022 is $75,000. And then again, that would be spread out amongst 12 focal points based on a formula that the county devises that has a lot of criteria: age, urban versus rural, income, diversity, that kind of stuff. Cultural diversity is $54,000. The mental health resources request is at $58,000. And that was really to bring up the salaries. It was a real struggle to hire a nurse at the wage that was being offered. And so they want to bring this salary up a little higher. And then nutrition, they're asking for 24,000. So what happens is this moves through the Area Agency on Aging Board, gets approval, the focal points will then prioritize, because you can't, we just keep narrowing it down. And then once this gets through Health and Human Services, we start to reach out to Dane County Board Supervisors and ask for them to fund this or to support these funding requests. So it's a long process, just like the city process, and it won't be over until the fall. So anyway, that's just a quick overview. And then connected to our county contract. So this year we got $92,299, and that was for nutrition, case management, MA case management. Because we are taking on the Hy-Vee congregate program, the county does this a little bit differently. The city has to pay Hy-Vee for these meals on Wednesdays, and then the county reimburses the city. But what they're gonna do is they're gonna just allocate $10,900, $920 right now for the rest of the year. So that will be a pot of money that I can pull from to pay the Hy-Vee, the meals. But that constitutes a budget amendment. So you will see a budget amendment on our next agenda that we will have to approve to accept these funds. What happens at the end of the year, if we use more, the county will make up for that loss. And if we lose less, the city will have to give that money back to Dane County. So you'll see that budget amendment coming down the pike. And let's see. Any questions about all that county stuff? Sometimes I ramble too fast. Okay. And I think really that is all that I have for now.
Okay, thank you.
Look at that.
Item number 7, other announcements. Anybody have any additional announcements or input? Our next meeting will be August. Oops. Ruth, did you say something?
Yes, sorry. I had a question about this new rehab hospital proposed for, it looks like the space that was going to have an assisted living. Are you familiar with that at all, Jill?
I just got a little bit of wind of that, but I don't know a lot of details, but I'll find out more.
Okay.
Yeah.
Anything else? Okay, next meeting, August 12th. Do I hear a motion for adjournment?
So moved.
Do I hear a second?
Second.
All in favor?
Aye.
Opposed? Adjourned.